Good morning, everyone. I hope you already watched the learning video on data collection, an overview to give you a brief discussion on data collection methods. This is somehow give you the idea on the basic concepts on data collection techniques. After identifying the proper research design, you shall decide for what method or strategies you are going to employ to gather pertinent data and to come up with the definitive result. Okay, today we're going to discuss about the data collection. Here are the following objectives that we are trying to meet while the discussion is going on. And at the end of the discussion, you can able to fully understand the subject matter. Okay, number one, evaluate a researcher's decision to use existing data or to collect new data. Okay, number two, discuss the dimensions along which data collection approaches vary. Identify phenomena that tend themselves to self-reports, observation, and physiologic measurements. And number four, distinguish between and evaluate structured and unstructured self-report, open-ended and closed-ended questions, and interviews and questionnaires. Number five, distinguish between and evaluate structured and unstructured observations and describe various methods of collecting, sampling, and recording observational data. And lastly, to describe the major features and advantages of biophysiologic measures. Okay, existing data versus original data. Okay, most researchers collect original data generated specifically for this study, but sometimes they can take advantage of the existing data. Secondary analysis, for example, rely on the data that had been gathered by others. Historical researchers and meta-analysts also rely on available data. Okay, existing records are an important data source for nurse researchers. Okay, a wealth of the data gathered for other than research purposes can be fruitfully exploited to answer research questions. Like for example, the hospital records, patient charts, care plan statements, and the like all constitute rich data sources to which nurse researchers may have access. Okay, the most salient advantage of research is that they are economical. The collection of original data is often time-consuming and costly. Di ba nga pag magko-collect ka ng bagong data, medyo mas time-consuming nga siya. Of course, you're going to exert more effort and of course, spend some money. Okay? On the other hand, when researchers are not responsible for collecting data, they may be unaware of the records biases. Okay? There is a tip. The difference between using records and doing secondary analysis is that researchers doing a secondary analysis typically have already to analyze dataset, whereas researchers using records have to assemble the dataset and considerable coding and data manipulation usually are necessary. Example of a study using records. Okay, the Heavy and colleagues on the year 2008 used data from 4,237 charts of economically disadvantaged young women attending a family planning clinic to explore demographic factor like for example the age, the race, and the economic ones, the health insurance associated with differences in contraceptive choices. Okay, so what are the three types of data collection? We have the self-report, observation, and lastly, the biophysical or biophysiologic measures. Okay, what are the difference of the three? Okay, so self-report are participants' responses to question posed by the researchers as in an interview. Okay, so it can be in the form of questionnaire or it can be in the form of an interview. Okay, self-reports are most common data collection approach in both qualitative and quantitative nursing studies. Okay, so mamaya iisa-isahin natin yung mga examples or yung mga types of self-report, observation, and of course the biophysiologic measures. Okay? On the observation naman, it is a direct observation of the people's behavior, on how the person is behaving, the characteristics, and the circumstances is an alternative to self-report for certain research questions. Okay, so you are observing, then you may have a guide for you to able to evaluate that certain person. Okay, that is the classic example of observation. The physiologic measures naman is nurses also use physiologic measures to assess the importance of clinical variables. Okay, usually ginagamit ito sa mga medical field. Okay, like for example, if they wanted to know the efficacy of the drug, of a certain drug, effectiveness of the certain drug, okay, they uses biophysical measures, okay, kung effective nga ba yung isang drug na kanilang na-create. Okay, comparisons of data collection in three qualitative traditions. Okay, traditions: ethnography, phenomenology, grounded theory. Okay, so we have already discussed these three types of qualitative studies. Okay, let's move with the unit of data collection. Of course, the ethnography uses the cultural system, phenomenology, and the grounded theory uses individuals. Okay, for the data collection points, mainly longitudinal ang ethnography. Ang phenomenological naman is mainly cross-sectional, and grounded theory, it's either cross-sectional or longitudinal. Okay, for the length of the time of data collection, typically, mas mahaba talaga pag nag-gather ka ng data for the ethnography studies. Okay, for the phenomenology, okay, typically moderate, and same true with the grounded theory. Okay, the salient field issues. Okay, for the ethnography, gaining entry, determining a role, learning how to participate, reactivity, encouraging candor, loss of objectivity, premature exits, and flexibility. For phenomenology, okay, bracketing one's view, building rapport, encouraging candor, listening while preparing what to ask next, okay, keeping on track, handling emotionality. Okay, for the grounded theory, you have building rapport, encouraging candor, listening while preparing what to ask next, keeping on track, handling emotionality. Okay, what are the key dimensions of data collection methods? Okay, we have four: the structure, quantifiability, obtrusiveness, and objectivity. Okay, for the structured, okay, in structured data collection, the same information is gathered from all participants in a comparable, pre-specified way. Sometimes, however, it is more appropriate to allow participants to reveal relevant information in a naturalistic way. Okay? Quantifiability. Okay, data that will be analyzed statistically must be quantifiable. Okay? So, structured data collection approaches tend to yield data that are more easily quantified. Okay? Para naman ma-quantify natin yung mga responses nila para mas madali natin silang i-interpret. Okay? Obtrusiveness. Data collection methods differ in the degree to which researchers are obtrusive in their effort and participants are aware of their status as study participants. Okay, objectivity. Quantitative researchers generally strive for methods that are as objective as possible. Okay, in qualitative research, however, the subjective judgment of the investigator or the researcher is considered a valuable thing. Okay, that is the key dimensions of the data collection method. Okay, so let's go to more specific. Okay, self-report qualitative techniques. Okay, qualitative self-reports usually obtained through interviews, okay, tend to be conversational. Okay, unstructured interviews which are used by researchers in all qualitative research traditions, encourage respondents to define the important dimensions of a phenomenon and to elaborate on what is relevant to them rather than being guided by investigators' a priori notions of relevance. Okay, unstructured interviews. Unstructured interviews are used when researchers have no preconceived views of the content or flow of the information to be gathered. Okay, their aim is to elucidate respondents' perception on the world without imposing their own views. So, whatever be questions na pwedeng ibato sa tao or dun sa ini-interview mo, so that's what we call unstructured interviews. Okay, semi-structured interviews naman or focus interviews are used when researchers have a list of topic or broad questions that must be addressed in an interview. So, medyo prepared ito, semi-structured interviews wherein you have the list of a topic or a question na pwede mong ibato dun sa i-interviewin mo. Interviewers use a written topic guide or interview guide, okay, to ensure that all question areas are covered. Okay, the interviewer's function is to encourage participants to talk freely about all the topics on the guide. Okay, example of the semi-structured interview by Brown and colleagues on the year 2008 explored the perceived impact of childhood leukemia on the career development and expectations of a young survivor via semi-structured interview with 11 young men and women. Example of questions they asked are how if at all has your cancer diagnosis affect your educational plans? Okay, then the interviewer have to respond according to the question, and tell me something about your future. Okay, so that are the example of the semi-structured questions during interviews. Okay, focus group interviews. The focus group interviews are interviews with group of about 5 to 10 people whose opinion and experiences are solicited simultaneously. Okay, but focus group interview. So there are 5 to 10 people, tapos ikaw na nag-i-interview, then you are asking the same question to them, then you are going to gather their responses. Okay, the interviewer or the moderator guides the discussion according to the topic guide. Okay, the advantages of the group format are that it is efficient and can generate a lot of dialogue. Okay, although not everyone is comfortable sharing their views or experiences in front of a group, focus group have been used by researchers in many qualitative traditions and can play a particular important role in feminist critical theory and participatory action research. Okay? So, para lang siyang simple gathering or simple meeting wherein you serve as a moderator or interviewer or the facilitator of that certain meeting. Okay, example of the focus group interviews, okay, by Sivan and colleagues in the year 2008 conducted a focus group study to learn about how parents from different racial or ethnic and income groups views children behavior problem and two instrument used to assess them. Okay, 15 focus group. Okay, separate ones from mother and father from the three racial or ethnic backgrounds were conducted at an urban medical center. An example of questions from the interview guide is if you saw a child aged 2 to 4 years old in your neighborhood and you said to yourself, wow, that kids got problems, what behavior would you be seeing? Okay. Next, of course, the diary. Okay, so personal diaries have long been used as a source of data in historical research. Okay, life histories are narrative self-disclosures about individual life experiences. With this approach, researchers ask respondents to describe, often in chronologic sequence, their experiences regarding a specific theme, either orally or in writing. Okay, some researchers have used this approach to obtain a total life health history. Okay, it is also possible to generate new data for a study by asking the participant to maintain a diary or a journal over a specific or specified period. Okay, diaries can be useful in providing an intimate description of the person's everyday life. Okay, so the diaries may be completely unstructured. Okay, for example, individuals who have undergone organ transplantation could be asked simply to spend 10 to 15 minutes a day jotting down their thoughts. Okay, frequently, however, subjects are requested to make entries into the diary regarding some specific aspects of their experience, sometimes in a semi-structured format. Okay, example of the diaries by Bray 2007 explored the inpatient experiences of adolescent aged 13 to 16 during their hospitalization for a planned surgery. The youth were asked to keep an structured diary for their experiences during their hospital stay, and they were also interviewed 2 weeks after the discharge. The diaries provided data and also served to aid discussions in the interviews. Okay, that is the diaries. Okay, let's move with the critical incidents technique. Okay, the critical incident technique is a method of gathering information about people's behavior in specific circumstances. Okay, the technique focuses on the factual incident. Okay, an observable and integral episode of the human behavior. Critical means that the incident must have had a discernible impact on some outcome. Okay, the technique differs from other self-report approaches in that it focuses on something specific about which respondents can be expected to testify as expert witness. Okay, generally data on 100 or more critic incidents are collected, but this typically involves interview with a much smaller number of people because each participant can also describe multiple incidents. Okay, example of the critical incident study by Sharoff on the year 2008 used the critical incident technique in a study of holistic nurses' use of complementary and alternative modalities in the care of their client. Participants were instructed, please think of an important event of your practice where you utilize a modality. Please reflect on how this experience affected you in your practice as a holistic nurse, and please briefly describe this incident. Okay, so it seems like it is a written or a verbal disclosure of a certain incident. Okay, think aloud method. Okay, the think aloud method has been used to collect data about cognitive processes, okay, such as problem solving and decision making. Okay, this method involves having people use audio recording devices to talk about the decision as they are being made or while problems are being solved over an extended period. So there must be a problem and how they have solved it. So their response serve as your data. Okay, the method produce an inventory of decisions and underlying processes as they occur in a naturalistic context. Okay, that is think aloud method. Let's move with the self-report quantitative techniques. Okay, structured approaches to collecting self-report data are appropriate when researchers know in advance exactly what they need to know and can frame appropriate questions to obtain the needed information. Structured self-report data are usually collected by means of formal or written documents, or what we call an instrument. Okay, so the instrument is known as an interview schedule when the questions are asked orally in a face-to-face or telephone format, and as questionnaire when respondents complete the instrument themselves. Okay, question forms. Okay, we have two, the close-ended and the open-ended questions. When you say close-ended questions, or the fixed alternative questions are ones in which the response alternatively are pre-specified by the researchers. The alternative may range from the simple yes or no, okay, to complex expression of the opinion. The purpose of such questions is to ensure comparatively of the responses and to facilitate analysis. Okay? For the open-ended question, many structured instruments, however, also include some open-ended questions which allow participants to respond to questions in their own words. Okay, when open-ended questions are included in questionnaires, respondent must write out their responses. In interview, the interviewer writes down responses verbatim or uses tape recorder for later transcriptions. Okay, so here are the example of the question types. We have the open-ended questions like what led your decisions to stop smoking. So that's an open-ended questions wherein the respondents, okay, may respond to that kind of question. Okay, so i-elaborate niya mabuti yung kanyang experiences. Okay, so please describe your experiences on the day you were discharged from the hospital. Okay, open-ended question. Dichotomous questions like, for example, have you been hospitalized as an inpatient at any time in the past 5 years? That is answerable by yes or no. Okay, or multiple choice questions. How important is it to you to avoid a pregnancy at this time? Okay, it is extremely important, very important, somehow important, or not important at all. Okay, so cafeteria questions. There are people have different opinions about the use of estrogen replacement therapy, the women at menopause. Which of the following statement best represents your point of view? Okay, so number 1, number 2, number 3, number 4, number 5. So may mga statement, then in a form of a checklist, i-check nila kung ano doon yung response nila or i-shades or ititik nila. Okay? So another, the rank order questions. People value different things in life. Below is the list of the things that many people value. Please indicate their order of importance to you by placing 1 beside the most important, 2 beside the second most important, and so on. Like for example, for the career, family relationship, friendship, health, money, or religion. So, saan dyan yung mas importante sa'yo? Saan dyan yung susunod hanggang sa pinaka-least important? Okay, that's the rank order question. When we say forced choice questions, okay, which statement, okay, most closely represent your view of point? Okay, number 1, what happens to me is my own doing. Okay, sometimes I don't have enough control over my life. So, meron ng predetermined answers or statements. So, ang gagawin mo na lang doon is ititik mo na lang. Okay, rating questions. Okay, on a scale of 0 to 10, where 0 means extremely dissatisfied and 10 mainly extremely satisfied. Okay, how satisfied were you with the nursing care you received during your hospital stay? Okay, 0 is the extremely dissatisfied, then 10 is the extremely satisfied. So, bibilugan mo lang or isa-select mo lang yung appropriate number that that corresponds your response. Okay, your answer to that question. Okay, that is rating question. Okay, in construction of the instrument, okay, in drafting or borrowing questions for a structured instrument, researchers must carefully monitor the wordings. of each question for clarity. Okay, so naiintindihan ba yung mga questionnaires? Okay, sensitivity to respondents' physiological state, absence of bias, it must be free from bias, and in questionnaires, the reading level. Okay, naintindihan ba ng magiging respondents mo if ganito yung construction ng iyong mga questions? Okay, so you have to consider that. Okay, question must be sequenced in physiologically meaningful order that encourage the cooperation and candor. Okay, draft instruments are usually critically reviewed by peers or colleagues and then pre-tested by the small sample or respondents. So, i-float mo yung questionnaire mo, then let them answer it, then kung ano yung criticisms nila for that or suggestion nila for your questionnaires. So, that's what we call a pilot testing. Okay, so a pretest is a trial run to determine whether the instrument are useful or is useful in generating the desired information. Okay, mamaya pala hindi nila maintindihan yung certain question na to. So you have the time to revise it. Okay, through your because you have conducted a pilot study. Okay, the development and free testing of the self-report instruments can take many months for you to able to complete. Okay? So scales and other forms of structured self-report. We have the scale, the widget, and the Q sorts. Okay, several specific types of structured self-report are used by the nurse researchers. This includes the following. Okay, so the scale, the widget, and the Q sorts. Okay, scale. Okay, scale is a device that assigns a numeric score to people along a continuum, like a scale for measuring weight. Okay, social psychological scale quantitatively discriminate among people with different attitudes, perception, and psychological traits. Okay, isa dyan sa scale na ginagamit natin is the Likert scale. The most common scaling technique is the Likert scale, which consists of several declarative, okay, statements or items that express a viewpoint on the topic. Okay, respondents are asked to indicate how much they agree or disagree within the statement. Okay, example of a Likert scale. Gomez and colleague on the year 2007 administered the death anxiety scale, a 20-item Likert scale to sample of over 700 men and women. Examples of items of this scale includes: I get upset when I am in a cemetery and I frequently think of my own death. Okay, so here is the example of a Likert scale to measure the attitude toward a condom. Okay, so strongly agree, agree, neither agree, or disagree, disagree, and strongly disagree. Okay, so ang gagawin lang nila dyan is i-check lang nila dyan. I-check lang nila yan. So, then after that, bibilangin natin kung ilan yung nag-response ng strongly agree, agree, neither agree or disagree, or strongly disagree. Okay, that is the relevant of the Likert scale numerical. Okay, para ma-determine natin yung or ma-quantify natin yung kanilang mga responses. Okay, moving on, the semantic differential. Okay, so another technique for measuring the attitudes is the semantic differential or the SD. With the semantic differential, respondents are asked to rate concepts, okay, like for example, dieting or exercise on a series of bipolar adjectives such as good or bad, effective, ineffective, important or unimportant. Okay, respondents place a check at the appropriate point on a 7-point scale that extends from one extreme of the dimension to the another or to the other. Okay, semantic differentials are flexible and easy to construct, and the concept being rated can be virtually anything: a person, a concept, or a controversial issue, and so on. The scoring procedure for ST responses is similar to that for the Likert scale. scale. Okay, scores from 1 to 7 are assigned to each bipolar scale response, okay, with higher scores generally associated with the positively worded adjective. Okay, responses are then summed across by the bipolar scales to yield a total score. Example of this is the Fitzgerald and colleagues on the year 2008 developed tested the diabetes semantic differential scales, which involved having patients and providers rate 18 diabetes care concepts and 9 sets of bipolar adjectives. For example, one stimulus help my diabetes from family, and adjective pairs includes tense or relaxed, unsafe or safe, or weak or strong. Okay? So the visual analog scale, or the VAS, is another type of psychosocial measurement, okay, which can be used to measure subjective experiences such as pain, fatigue, and dyspnea. Okay, example natin dyan is yung pain scale natin na may mga picture. Okay, the VAS, or the visual analog scale, is a straight line, okay, the end anchors of which are labeled as the extreme limits of the sensation or feeling being measured. Participant marks a point on the line corresponding to the amount of sensation experienced. Okay, traditionally, a visual analog scale line is a 100 millimeter in length, which makes it easy to describe or to derive a score from 0 to 100 by simply measuring the distance from one end to the scale to the mark of the line. Okay, example of this visual analog scale is Litherland and Scotch 2007 conducted a randomized controlled trial, or the RCT, to test patients' discomfort with two alternative single-use catheters among 196 women undergoing urethral catheterizations of the urinary bladder. Patient discomfort was measured using the visual analog scale. Okay, so responses to set bias. Okay, these biases can be reduced through such strategies as counterbalancing positively and negatively worded statements. Okay, developing sensitively worded questions, creating a permissive, non-judgmental atmosphere, and guaranteeing the confidentiality of the responses. Okay, social desirability response set bias. Okay, a tendency to misrepresent attitudes or traits by giving answers that are consistent with prevailing social views. Okay, for example, ito yung view ng karamihan. So, ito na yung magiging response ko. Parang ganon. Okay, extreme response set bias, a tendency to consistently express extreme attitude or feelings, or example, strongly agree, leading to distortions because extreme responses may be unrelated to the traits being measured. Okay? Acquiescence response set bias, a tendency to agree which statements regardless of their content by some people, okay, the opposite tendency for the other people to disagree with statements independently of the question content is less common. Widgets, okay, is the another self-report approach, includes the use of widget, okay, which are brief descriptions of events or situations to which respondents are asked to react. Okay? The descriptions, which can either be fictitious or based on a fact, or structured to elicit informations about the respondent's perceptions, opinion, or knowledge about a phenomenon. Okay? The question posed to respondents after the widget may be either open-ended, like for example, how would you describe this patient's level of confusions? Or it can be close-ended, like rate how confused you think this patient is on a 7-point scale. Okay, usually 3 to 5 widgets are included in an instrument. Okay, sometimes the underlying purpose of widget studies is not revealed to participants, especially if the technique is used as an indirect measures of attitude, prejudice, and stereotypes using embedded descriptors. Okay, as in the following examples. Okay, example is the Griffin, Pollitt, and Brint using widgets describing hospitalized children to determine if pediatric nurses' pain management decisions can affect by the characteristics of the children. The tree widget describes children in pain. One describe either a boy or a girl, another describe a white or an African American child, and the third describe a physical attractive or unattractive child. Okay, nurses answered questions about the pain treatments they would administer without being aware that the child or the children's characteristics have been experimentally manipulated. Okay, Q sorts. In a Q sorts, participants are presented with a set of cards on which words or statements are being written. Okay, participants are asked to sort the cards along a specific bipolar dimension such as agree or disagree. Okay, typically, there are between 50 to 100 cards to be sorted into 9 or 10 piles. Okay, with the number or cards to be placed in each pile predetermined by the researcher. Okay, the sorting instructions are and objects to be sorted in a queue sort can vary. For example, patient could be asked to rate nursing behaviors on the most to least helpful continuum, or trauma patients could be asked to rate aspects of their treatment on the most to the least distressing continuum. Okay, example of the Q-sort study by Heron, Marks, and co-researchers in the year 2007 uses a Q-sort to explore women's experiences of and during postnatal, perineal, and pelvic floor morbidity. Okay, statements of the 36 cards to be sorted into 9 piles on an agree or disagree continuum uh, were developed from an earlier in-depth study with a sample of postpartum women. An example of a statement in the card is that my perineum sometimes feels dry. Okay, so evaluating the self-report method. Okay, self-report technique is the most common method of data collection in the nursing studies. Okay, are strong with respects to their directness. Okay, so ito yung usual natin ginagamit, the self-report methods. Okay, self-report methods have some weaknesses. Okay, the most serious issue concerned is the validity and accuracy of the self-report. Okay, sometimes, okay, we are being questions kung valid pa yung mga nag-gather natin na data. Okay, accurate ba sila? Yan. You should also be aware of the merits of unstructured and structured self-report. Qualitative self-reports are extremely time-consuming and demanding, however, and they are not appropriate for capturing the measurable aspects of a phenomenon such as an incident. Okay, structured self-reports are also appropriate when researchers want to to test the hypothesis concerning the relationships. Okay. So we are done with the self-report. So let's move with the observation. Qualitative techniques. Okay, observational method can be used to gather such information as the condition of an individual, like for example, the sleep-wake state of the patients, or verbal communication, like exchange of information at change of shift report, or the nonverbal communication like of the body language or activities like for the geriatric patients, self-grooming activities, and lastly, the environmental conditions like for example the noise, the level in the nursing homes. Okay, these are the things that to be observed. Okay, so what are the important dimensions in observational studies? Number one is the focus of the observation. Okay, the focus can be on a broadly defined events. For example, the patient's mood swing, or on the small, highly specific behavior, like for example, the gesture and the facial expressions. Okay, you should have to focus on these observations. Okay, concealment. Researchers Okay, do not always tell people they are being observed. Okay, because awareness of being observed may cause people to behave atypically, thereby jeopardizing the validity of the observation. The problem of behavioral distortions owing to the known presence of an observer is called reactivity. Okay, like for example, you are tasked to observe the nurses doing their hand washing. Okay, if they do their hand washing, abiding the 5 moments of hand hygiene, so doon dapat hindi aware yung mga nurses that you are observing para makakuha ka ng mas reliable na data. Okay, that is the principle behind the concealment. Okay, duration. Some observations can be made in a short period of time, but others, particularly those in ethnographic studies, may require months or years in the field. Okay, so other factor is the duration, of course. Like for example, you are conducting a study of ethnography. Okay, syempre mas matagal kasi mas madami kang kailangan i-observe to them. Okay, methods of recording observations. Observations can be made through the human senses, okay, with the use of our eyes, ears, nose, okay. Then, but this can also be done with sophisticated equipments, like for example, video equipment, audio recording equipment, and of course, computers. Okay. Naturalistic observations often are made in field settings through participant observation. A participant observer participates in the functioning of the group under study and strives to observe and record information within the context and experiences that are relevant to the participants. Okay, we have tip here. Some research reports state that participant observation was used, even though the description of the method suggests that observation but not participant was involved. Some researchers appeared to use the term participant observation inappropriately to refer all unstructured observation conducted in the field. Okay, the observer participant's role in participant observation. Okay, according to Leininger and McFarland, 2006, describe a participant observer's role as evolving through the 4 phases sequence. So, primary observation and active listeners. Okay. Then, number 2, primary observations with limited participations. Then, primary participations with continued observations. Then, primary reflections and reconfirmations of findings with the informants. Okay, example of participant observer roles, okay, by Sutton and colleagues on the year 2008 undertook an ethnographic study of professional nursing culture on the trauma unit, okay, from the perspective of both nurses and patients. Okay, participant observation was one of the methods used. Over the 16 periods of observation, the researchers took the role of observer as participant. Okay, this involved sitting quietly in one corner of the room but um, participating in conversations while inviting and undertaking minor tasks such as moving footstools and getting the drinks. Okay, there's example of participant observer role. Okay, gathering participants' observation data. Among the aspects of an observed activity likely to be considered relevant are the following. Okay, the physical setting, the participants, the activities, the frequency and duration, the process, and of course the outcome. So the physical setting, where, saan? Where questions, where is the activity happening? What are the main features of the settings? What are the contexts within which behaviors unfolds? Okay, the participants, who questions, who is present, what are the characteristics and roles, who are given access to the settings. Okay, activities naman is the what questions. Okay, what are going on, what are the participants doing, what methods do they use to communicate, and how frequently do they do so? Frequency and duration. When? Questions naman itong mga to. When did the activity begin and ends? Is the activity a recurring one? And if so, okay, how regularly does it recur? Okay, for the process, this is the how questions. How is the activity organized? How does the event unfold? For the outcome, this is the why questions. Okay, why is the activity happening, or why is it happening in this manner, or what did not happen, especially if it ought to have happened, and why. Okay, researchers generally use a combination of positioning approaches. Okay, the single positioning, multiple positioning, and the mobile positioning. When we say single positioning, means staying in the one location for a period to observe, okay, transactions in that location. So, specific lang, isang location lang siya mag-observe. When we say multiple positioning naman, involving moving around the site to observe behaviors from the different locations. So, it involves various locations, different locations naman na mag-observe ka. Then, mobile positioning involves following a person's throughout a given activity or throughout the period. Like for example, you are going to observe that person in a duration of a week or a month or a 3 days, 4 days, ganyan. So that is a mobile positioning. Okay, as a way of gathering participants' observation data. Okay, for the recording of your observation, it can be in the form of log, field notes, and photographs and videotapes. Okay, let's define what is log or the field diary. It's a daily record or events and conversations. Okay, field notes are broader and more interpretive. Okay, so field notes represents the observer's effort to record informations and to synthesize and understand the data. Okay, we have different types of field notes: the descriptive, reflective notes, theoretic, methodologic notes, and of course the personal notes. Okay, when we say descriptive notes or the observational notes are objective descriptions of events and conversations and the context within which they occur. Okay, so you're just describing what is happening. So that is descriptive notes. Okay, reflective notes naman documenting or document researchers' personal experience, reflections, and progresses in the field and can serve as a number of the different purposes. So what would be your personal experience or your experiences while you are doing the observation? Okay, so theoretic notes naman is document interpretive efforts to attach meaning to the observation. So you are putting something meaning to the observation. Okay, methodologic notes are reminders about how subsequent observation should be made. So dapat chronologically, tapos dapat nakaayos yung mga notes mo. Okay? So, personal notes are comments about the researcher's own feelings during the research process. Okay? So, let's move with the observation on the qualitative techniques. Okay? Researchers often use structured observation in situations in which study participants cannot be asked questions or cannot be expected to provide reliable answers. Many structured observational instruments are designed to capture the behaviors of infants and children and older people whose communication skills are impaired. Okay, structured questionnaires involves the use of formal instruments and protocols that dictate what to observe and how long to observe it and how to record the data. Okay, unlike the participant observation, structured observation is not intended to capture a broad slice of ordinary life, but rather to document specific behavior or actions and events. Okay, number one is the categories and the checklist. Okay, the most common approach to making structured observation is the use of category system for classifying the observed phenomenon. Okay, a category system represents a method of recording in a systematic fashion the behavior and the events of interest that transpire within a setting. Okay, category systems are the basis for constructing a checklist. Okay, so which is the instrument um, observers use to record observed phenomena. Okay, the checklist is usually formatted with the list of the behavior or events from the category system on the left and the space for tallying the frequency or duration of the occurrence of behavior on the right. Okay, non-exhaustive system are adequate for many purposes, but one risk is that resulting data might be difficult to interpret. When a large number of behaviors are not categorized, the investigator or the researchers may have difficulty placing categorized behavior into perspective. Example of this is from Liao and colleagues on the 2006 studies changes in pattern of infant distress at different phases of a routine tub bath in the neonatal intensive care unit or NICU. The researcher developed a system to categorize behavior signs of distress, like for example the jerk, tremors, grimace, and arcing. Behaviors unrelated to distress were not categorized. Okay, rating scales. Okay, rating scale is a tool that requires observers to rate some phenomenon in terms of points along a descriptive continuum. Okay, another approach to structured observation is the use of the rating scale. Okay, so ang example nito is return demonstrations. Okay, wherein the students or the nursing students is doing his or her return demonstrations, and the clinical instructor is rating the students accordingly with the use of a structured checklist. Okay, so the observer may be required to make ratings of behavior at interval throughout the observations or to summarize an entire event or transactions after the observation is completed. Okay, then after that, saka mo sasabihin or i-reveal sa kanya kung ano yung mga observations mo after the return demonstrations. Okay, the clinical instructor. Okay, example of the observational ratings is the NEECHAM confusion scale on an observational measures for recording the presence and severity of acute confusion has subscales that involve behavioral ratings. For example, one rating in the processing subscale concerns alerting or alertness or responsiveness. Ratings are from 0 for responsiveness depressed to 4 for full attentiveness. Okay, the said scale has been used for both clinical and research purposes. For example, Bond and colleagues on the year 2006 uses this scale scores as their measures to delirium with 76 hospitalized patients with cancer. Observers use the scale at admissions during hospitalizations and at discharge. Okay. Researchers must decide whether to apply their structured observational system. Okay, observational sampling methods provide a mechanism for obtaining representative examples of the behaviors being observed. Okay, when we say time sampling, one system is time sampling, which involves the selections of time periods during which observations will occur. Time frames may be selected systematically, for example, every 30 seconds, at 2 minutes interval, or at random. Okay, when we say event sampling naman, with event sampling, researchers selects integral behavior or events to observe. Event sampling requires researchers to either have knowledge about the occurrence or events or be in a position to wait for their occurrences. Example of integral events that may be suitable for the event sampling include shift changes of nurses in the hospital and cardiac arrest in the emergency room. So, for example, merong cardiac arrest, then during CPR or during resuscitation, so you are going to observe the event. Okay, example of the event sampling is from Kakmak and Kugulu. On the year 2007, used structured observation to compare the breastfeeding pattern of the mother who had a vaginal birth with those who have delivered by the cesarean sections. Observations were made for the first three breastfeeding sessions of 200 mother of a healthy neonates. Okay, that is example of the event sampling. There is a specific event, then you are going to observe it. Okay, evaluating the observational method. Okay, there are certain research questions are better suited to observation than to self-reports. Okay, observational methods have an intrinsic appeal to directly capturing the behaviors and the event. Okay, so certain research questions are better suited to observation than to research report or than to self-report, okay, such as when people cannot adequately describe their own behaviors. This may be the case when people are unaware of their own behavior, like for example stress-induced behavior, when behaviors are emotionally laden like grieving behavior, and when people are not capable of reporting their actions, like for example the young children or the mentally ill. Okay, observational methods have an intrinsic appeal for directly capturing behaviors and events. Moreover, nurses are often in a position to watch people's behaviors and may by training by specially sensitive observers. Okay, possible ethical problems and reactivity of the observed when the observer is conspicuous. Okay? So, yun nga, pag meron nag-o-observe tapos aware yung i-observe niya or yung participant natin is there is a bias, okay? Yun yung tinatawag natin na reactivity. Okay, the number of factors interfere with the objective observations include the following, like for example, emotions, prejudice, and values of the observer may lead to faulty inference, okay? People views may color what is seen in the direction of what observer wants to see. Okay, anticipation of what is to be observed may affect what is perceived. Hasty decisions may result in erroneous classifications or ratings. Okay, that ends the observation. Okay, let's move forward to the biophysiologic measures, quantitative techniques. Okay, we have two types, the in vitro and the in vivo. Okay, the in vivo measures are those performed directly within or on a living organisms, such as taking blood pressure, taking the body temperature, and the vital capacity measurements. In vivo instruments are available to measure all the bodily functions, and technologic advances continue to improve the ability to measure biophysiologic phenomenon more accurately and conveniently. Okay, example of the study with an in vivo measures is from Lee and colleagues in the year 2008 studied hypertension control and predictors of medication adherence in older Chinese immigrants living in the United States. A key outcome measure was blood pressure BP control, they defined as a average BP or the average over two readings and less than 140 over 90 millimeter mercury. Okay? So, yun yung mga example ng in vivo as biophysiologic testing. Okay, let's move with the in vitro. Okay, with in vitro measures, data are gathered from participants by extracting biophysiologic material from them and subjecting to it analysis by specialized laboratory technicians. Okay, example of this includes the chemical measures or the measures of the hormone, the measure of the sugar, potassium levels. Okay, medyo, ang sabi, medyo inconvenient nga lang to kasi nga you have to collect some specimen. Like for example, for us to measure the potassium level, you have to extract blood. Okay, microbiologic measures like bacterial count and identifications, okay, culture and sensitivity, and the cytologic and histologic measures, the histopathologic, okay, like for example the tissue biopsies. siyempre magkukuha ka ng certain specimen or certain tissues, tapos yun yung i-study natin. Okay? So example of the study with the in vitro measures is from Ward and colleagues on the year 2008 examines the children nocturnal sleep and nap behavior in relation to salivary cortisol levels sampled mid-morning and afternoon after naps in childcare centers. Okay, problem napping and disruption behavior were associated with higher afternoon cortisol levels. Okay, evaluating the biophysiologic measures. Okay, biophysiologic measures are relatively accurate and precise, especially compared with the psychological measures, okay, such as the self-reports, measures of anxiety, pain, and so forth. Okay, biophysical measures are objective. Okay, two nurses' readings from the same spirometer output are likely to record identical tidal volume measurements, and two spirometers are likely to produce the same readouts. Okay, patients cannot easily distort measurements of biophysiologic functions. Okay, biophysiologic instrumentations provide valid measures of target variables. Thermometers can be relied on the measured temperature and not blood volume, and so forth. Okay, for non-biophysiologic measures, there are typically concerns about whether an instrument is really measuring the target concept, or is the instrument is used is very efficient, or functional. Yun yung nagiging questions. Okay, implementing data collection plan. Okay, so sino ba ang magko-collect ng data? Okay, the circumstances under which data, ano ba yung data na dapat nating i-gather? Okay, when we are critiquing data collection method, okay, the goal of data collection plan is to produce data that are of exceptional quality. Okay, every decision researchers make about the data collection methods and procedure is likely to affect the data quality and hence the quality of the overall study. This decision should be critic in drawing conclusions about the study's capacity to answer the research questions or test the study hypothesis. Another important issue is to mix of the data collection approaches. Triangulation of the methods is often extremely desirable, especially in qualitative research. Thus, an important issue to consider in evaluating unstructured data collection is whether the type and amount of data collected are sufficiently rich to support an in-depth holistic understanding of the phenomenon under study. And finally, it is important to evaluate the actual procedures used to collect and record the data. Okay, this means considering who collected the data, how they were trained, whether formal instruments were adequately pre-tested, in what types of setting data collection occurred, and whether efforts were made to reduce biases. Okay, here are the guiding or guidelines for critiquing the data collection plan. Okay, basahin natin tong isa. Given the research questions and the characteristics of the participant, did the researchers use the best method of capturing study phenomenon? For example, self-report, observation, or biophysiologic measures? Was triangulation of the method used appropriately? Were multiple methods sensibly used? Okay, that is the example of critiquing the data collection method. Okay, that ends our discussion. Thank you for listening and goodbye.